And we're back with more of what's happening. What's happening as well, good vision, very important, and the good folks at Atlantis Eye Care certainly provide that to us. Dr. Sadri with us today, back from the group there, and good to have you on the show today.
Good morning, thank you for having us.
Welcome to you, good morning. So Atlantis really has facilities all over the area, several facilities that people can take advantage of, but you're local right here in our neighborhood for our folks here in the village, so that's a good thing. You're using some unique new equipment over there. We've all seen pictures of doctors wearing like a microscope type of deal as they work on people's eyes. You've got something new that you're using, and you're one of the first, I think, to have it here in Orange County.
Yeah, we're pretty proud of the newest technology that we can offer our citizens and the community in general. What essentially we're offering is the way to look at the eye in a totally different new way. So it's a three-dimensional image rather than the sort of the traditional way of doing cataract surgery, for instance, where the surgeon would sit at the bedside and have the patient using oculars for a microscope. What we do is actually move away from the microscope and have a three-dimensional image on a flat panel you would see. You can see a diagram of that here.
And it actually looks like a big screen TV set.
That's right. And you can see here in this image the big screen TV set there. You can see the surgeon on the left lower corner there, and what they're doing is looking through their 3D glasses onto the screen, and they get the same image that everybody else, including the anesthesia and the nurses, would get.
So all the people in the operating room, not just the doctor doing the procedure, gets to see it. I would understand that that's also probably helpful in an educational. I know you've done some work and training at UCI and other places. As you train the ophthalmologists of the future, you could have them sitting in the room observing this, not having to lean over your shoulder, but could actually watch it on the screen here. Absolutely
correct. So what we do is we see this technology having multiple impacts. One would be, to your point, teaching. So when we're teaching not only new doctors coming out in the community, but more advanced techniques to who are established surgeons. So I use this technology to do that because remember, it's three-dimensional.
Right.
And the second thing is you can do virtual surgery, or what we call telesurgery. I think that's going to be, you'll see with this technology, a birth of that. In other words, once the robotics of this surgery get better and better, you can actually see a surgeon in areas where there's no providers. Be able to provide the services via telesurgery. And I think you're going to be able to see that more and more as the technology develops.
Obviously, there are places in the world that don't have the technology that we have today. This allows you to really branch out and help more people really around the world there. What procedures would you use this for? Cataract surgery, laser surgery type of things, maybe?
Absolutely. As you know, because you've had LASIK surgery, we do a three-dimensional image virtual on any ocular surgery, which is microscopic. So that includes cataract surgery, all my glaucoma surgeries, I'd use this. Your pterygium surgery, which is pretty common surgery to have. You mentioned areas in the world which don't have impact. I was in Kenya last year, and you know we do about 100 surgeries in about a week. And imagine areas that I'm thinking when I'm not there, how many people are not having surgery. So, so that could impact a lot of people. We're excited because this actually is the beginning of other things to come.
You know, we think about other parts of the world where things that we take for granted, you know, good hygiene, sunglasses, things that we do to protect our eyes, they don't even have in some cases in some countries. So I guess there's some eye diseases that people have in some of those countries that probably nobody in the United States has, or very few.
Yeah, and to your point, just recently when I was out there, I operated on a 6-month-old who had cataracts in both eyes. She had walked 90 miles with her mother.
Wow.
And that just humbles you. So to your point, there are basic things that are out in parts of the world that you and I would not see because of great access to care. I would also tell you that there are areas in the U.S., here in Orange County, that we see that as well. So you don't have to go far to be able to see that.
We've seen those situations where somebody will rent a large hall, a stadium type of situation, and have a health clinic, and there'll be hundreds of people, thousands of people signing up to go to that. So you're right, there is those needs here in the United States as well. So you primarily are doing this type of work. Your training is in obviously all areas of the eye and all types of surgery. Obviously, depending on the age of the person and the condition of the eye determines really what you're going to be doing. It may be glaucoma, it may be cataracts, it may be laser surgery. Sometimes people have had maybe laser surgery at a younger age and end up having cataracts maybe a few years later. I understand that they're compatible now.
Yes, yeah, and you had a segment here not too long ago where we educated the public about lens implants. So to your point, as we learn more about the eye, as we're getting better and better, providing better care, the technology is just zipping past us. So we have, for instance, a large body of patients who have had LASIK surgery and now they have cataracts. So what do? Well, we have really refractive, what we call intraocular lens implants, which you had a segment on,
right,
that complements that nicely.
Yeah.
So what we're learning is we're providing more and more minimal invasive procedures for more people. There's less downtime, and there's just a high impact sort of outcomes.
Right. I know people that may have had family members that had cataract surgery, in the 30s, 40s, or 50s. They were in the hospital for several days, immobilized with sandbags. Now you do one eye, and a month later you do the second eye, and they're in and out in a few hours. Yeah,
exactly. The reason we used to call surgery, you may have heard, or the people may have heard, oh, you're not ripe yet, or you're not ready yet. It's kind of like a pear on a tree, was because, to your point, our surgery was so archaic, it would take 3 hours, and it would be 3 days in the hospital. And that was brutal. So we didn't want to subject people to that until they were absolutely medically ready. And so beyond that, now we have essentially laser procedures that are 3 minutes in my hands, that you go home by lunch,
right,
and you come back in a week later, do the other eye, and you're done.
Right, and I know it's amazing, people will sometimes, during the procedure, all of a sudden will maybe shout out or say, I can see, or I can see clearly now, or whatever. I know that's the case sometimes with cataract surgery, sometimes right after the fact, on the way home.
Yes.
I've heard people actually start to cry because it's so emotional. They're seeing things they hadn't seen for years.
Yes.
So it's amazing.
It's absolutely amazing.
Yeah, yeah. Speaking of crying, that's another thing you deal with is issues with tear ducts and those kind of eye problems as well, and too much or not enough, and that's dealing with that is another important area.
Absolutely. We're excited to hopefully have, if we have more ample time next time, to talk about those. And
we'll talk also about eyelid surgery, which is also something you folks do. So we'll talk about that next time as well.
Excellent.
Thank you for joining us. Good to have you on the program today.
Thank you. It's a pleasure.
Great technology over there available at Atlantis Eye Care. If you want to find out more, contact them by giving them a call at 581-1770. And again, you can learn more about the various offices and the various doctors and learn more about the great technology they're using as well. Thanks for joining us on the program today. We'll be coming right back with more guests as we continue with our program for you for today.